Joe coming at you in today's 2-minute health hack. Boy, do I have a real headache. No, just kidding. But I hear this a lot when patients come in and they say, Joe, what's good for a headache? And in this 2-minute health hack, I want to talk about some of the different products out there and what I think, my opinion, of course, what you should think about, and also some warnings when it comes to headaches. First off, there's only really a few categories over the counter. There's non-steroidal anti-inflammatories like ibuprofen, naproxen. Those are kind of the mainstay. Aspirin, there's acetaminophen, that's a big one out there. Then there's Excedrin, that's a combination that also has some caffeine that might be good sometimes for people that have a very mild migraine. And then there's diclofenac, which is not out yet, but I think it's going to be coming because it's big overseas right now. So these are the ones that are pretty much out there right now. And basically the usage guidelines say you take the medication as soon as you can. That's one of the key things. No matter what you're going to choose, as soon as you can, when symptoms first start for maximum effectiveness. And you should be taking these no more than 2 to 3 times per week, because you can get in the weeds with some of these, especially with acetaminophen. You don't want to exceed the maximum amount per day going on week after week or day after day. And with non-steroidals, you have to avoid things if you have kidney issues, ulcers, any drugs for bleeding, for clotting, any drugs that you're taking for clotting, this could be a problem. So, and there's also some evidence maybe magnesium might help. When to seek medical attention. Now, I think if you have a headache that's one of the worst ones you've had in your life, that's bad. That's a sudden onset like that. If you have one that's associated with a fever, stiff neck, if you have one that's interfering with your activities greatly, if you have one that's in, especially ability to focus, if it's interfering with your sleep. Now there's migraines, that's a whole different animal. We're not talking about there. We're talking about mild to moderate. People with migraines, there's a whole bunch of medications that are prescription that are very effective for that. We're not talking about that. We're talking about mild to moderate. Usually the muscle tension headaches. And you don't even realize this because of the muscle tension. But any severe symptoms when it comes to headaches, do not hesitate to talk to your healthcare provider about it, especially if this is going on weeks on end. So here's a call to action. I think of the 4, I like ibuprofen or NSAIDs the best for my headache. Other people said they like Tylenol. I like ibuprofen. And some of the study shows it might edge it out a little bit. That's still kind of debatable versus acetaminophen. So hope that tip helps. And if you have a headache, if it gets really severe and they're recurrent and they're not going away, go see a doctor. Hope that helps.